Hello and welcome to Beyond the Shift. I'm your host, Grace Wanjohi. Today we are going to talk about loss and grief, and especially in the healthcare setting. So what is loss? Loss is the absence of a valued possession. This possession could be a person, a property, a job, or a relationship. Grief is the emotional reaction to loss. It is characterized by shame, fear, anger, blame, guilt. And mourning is the outward manifestation of grief. So we are going to talk about the types of grief. And as we talk about them, I want us to think about the healthcare setting. Let us think of this family or a person who is about to lose their health, who is about to lose their life, and this healthcare worker who is taking care of this patient. So the first type of grief is anticipatory grief. This is grief before a loss. It could happen when someone is diagnosed with a terminal illness, or someone is told that they are going to lose their job, or someone is told they are going to lose a relationship, as happens in divorce. It could also happen in a hospital setup to a family when they see their loved one going down, changing. The condition is changing from better to worse. So as a healthcare worker, you need to know, as you are breaking the news to a person about this illness, about something that you need to do, like the loss of a body part, amputation. This is what is going on in their mind. Anticipatory grief. Loss of function, loss of independence, loss of a relationship. This means the loss of a social role. I was a wife, I was a mother. So this is anticipatory grief. The second type is called acute grief. This is what happens immediately after the loss. Like we have said, if it was a relationship, when it is finally terminated, that's immediate reaction to that loss. This is what is called acute grief. Like we have said, a person who is going to lose a body part, maybe amputation, maybe because of an accident and the leg is badly injured, or a body part is badly injured. This is what happens when they come from theater. They are mourning that loss. As much as they knew this was going to happen, this is what is happening to them. That type of grief is called normal grief. And there is nothing normal about grief. The reason it's called normal grief, it is because it is what is common to many people. So it is characterized by 4 areas. Physically, the person will feel some hollowness in their stomach, chest tightness. Some will have diarrhea. Some will faint. These are some of the physical things that you'll see in a person who is grieving. What about emotionally? There is emotional numbness, there is shame, there is guilt. Someone could feel like they didn't do enough for their loved one. Even a healthcare worker may feel like I didn't do enough. So there will be guilt, shame, blame. If I had done this, this could not have happened. So that is emotionally. What about behavior? The behavioral manifestation of grief include crying, overreactivity, screaming, changed relationships. Cognitive manifestation of grief is the 4th type of manifestation of normal grief. It includes confusion, poor memory, poor concentration, idealization, where you idealize this person who has, let's say, is someone who has lost their lives. The remaining members of the family, they only talk about the good things of this person. So in a way, this person is seeing this person as a very good person, the person who just departed. There is also a sense of presence. Someone could feel like, this person was with me here. I have seen him. I saw him in the morning. So this is what happens in the cognitive manifestation of grief. And there is also the area of dreams. Someone could dream that they were with this person. That is a cognitive manifestation of normal grief. The 4th type of grief is called complicated grief. It's usually death associated with, I'm mentioning death more because loss of death is final. So I don't mean to forget that there are many other kinds of losses. It happens to 20% of mourners, and this happens especially when there is loss of a spouse, loss of a child, someone who was very close to the bereaved. And this also occurs when there is sudden death. Let's say in the case of an accident, you have parted ways with this person in the morning, and within an hour or 2 hours, you are being informed that this person died. So this can lead to complicated grief, where this person does not behave like what we have said about normal grief. Their reactions to the loss are exaggerated. Sometimes they are delayed. You see a person mourning a loved one 2 years later, where a person masks. They feel the pain, but they are masking and going on with their daily tasks as if nothing has happened, but they are still grieving inside. And finally, the fifth type of grief is called disenfranchised grief. This is grief that occurs and is not socially accepted. Let's say there was a girl having an affair with a married man and she dies. The society does not approve of that death. So the family of this girl is going to have a hard time because they are being judged by the society. And also death that occurs through things that we stigmatize. They are stigmatized diseases. Things like suicide, homicide, they are stigmatized. So this is what will happen to the people who are left behind. They are going to go through disenfranchised grief because they are grieving a type of grief that is not socially accepted or socially sanctioned. Those are the 5 main types of grief. Let's now talk about professional grief. This is grief that happens to people in helping professions. But on this show, I'll be talking more about the healthcare setting because that is where most of the losses will happen. But it does not mean that other helpers do not face the same challenges. So healthcare workers face grief and face loss again and again, especially for those people working in a hospital setup. So what happens, they face loss today, they don't deal with it, then tomorrow they face another loss. So it is accepted as part of the job. And they have to balance between grieving their patients and ongoing job demands. So there's a lot of pile-up of loss. Remember, this person could be facing loss in their own life. They could have lost a patient. They could have lost a loved one in the past. And the current situation triggers. Let's say you lost a loved one with cancer. And in the ward, there's another patient who is having cancer. If this healthcare worker has not dealt with the past loss, this situation is going to trigger. And that is why it is so important for the healthcare providers to deal with loss so that they are able to handle the loss that is coming to them on a daily basis. Because assuming they have not dealt with their past losses of loved ones, of patients, any other loss coming in is going to trigger them and cause compounding grief. I'm advocating for people to deal with grief, the healthcare setting to be kind to healthcare workers, and to have a place where people can sit and process their emotions after the loss of a patient. Many times we are thinking about the family, about what to tell them, how to prepare them to handle the news, but we forget the healthcare worker who is carrying out this task. So, what is research saying? Research says that we are supposed to have a room in the hospital setting where people can go and process their emotions, where the healthcare workers can go and break news of death to the family, because the bedside is not an ideal place for that process of breaking the news. People need to be somewhere where they sit down. They can ask each other questions so that they can understand what just happened to their loved one. And also this healthcare worker can sit behind and try to cope with those feelings so that they are available for the next patient who comes and for the rest of the patients who have remained in the ward. Because this idea that healthcare providers can deal with loss and they are able to cope with it is being challenged by research. Research shows that they feel it. They feel the loss of a patient. It is not just the loss of a patient, it is also loss of self-identity, because the healthcare provider is asking themselves, did I do everything possible to prevent this death? Is there something else I could have done? So sometimes it can make somebody feel a reduced professional efficacy. They may feel like, I could have done better, I could have done this. So it is good for people in helping professions, the psychologists, the pastors, the people in social work, to have a place for processing their emotions after the loss of their client, after the loss of their patient. Sometimes, because of the acute reaction that we have said, family members will blame the healthcare providers. You could have done this. You did not do this. My patient would not have died. My loved one could not have died. So, on top of managing their own grief, the loss of the patient, the job, the ongoing job demands, they're also managing the family. It's also said that in the healthcare setting, there is a culture of emotional suppression. Have you ever seen your healthcare provider crying openly? I don't think so. So there is a kind of emotional suppression. So you think they don't feel, but they are feeling this loss, but there is a culture of showing that you don't feel it, but this person is feeling that loss. So what can we do about this in the healthcare setting? One, we can encourage emotional expression of grief. Of course, not in front of the client, not in front of the family, but set aside a place where the healthcare provider can go and process their emotion. What has just happened? This loss, did I do everything? Let them evaluate themselves, let them have time. So that is what research is saying, that there needs to be a place for people to sit and process the emotions after the loss of a patient. There also needs to be a structured way in a hospital setup on handling grief. Who breaks the news? Let's say you are working as a team of 5 healthcare providers. Who is in charge of breaking the news to the family? Who is in charge of calling the family members after a loss? So there need to be such structures. There needs to be training on how to handle loss and grief as a professional, and also how to handle the family, how to handle the bereaved. That structure is not there currently. There are not many places. At least for me, I know I was not trained on that. So it needs to be done. There also needs to be structures like psychological debriefing. Once in a while, let people come together, let them express what is happening to them. Like during the COVID-19 epidemic, there were mass deaths. So many people dying at a particular time, many people dying in a span of few days, few hours. What is happening to this healthcare worker? So there needs to be structured psychological debriefing. And also people are encouraged to have self-care plans. How do you take care of yourself after this shift where you have handled a lot of grief? You have dealt with the loss of the patient, you have dealt with the family, you have dealt maybe with your seniors. Maybe there is blame game. This one did not do this, this one was supposed to do this. So how do you take care of yourself so that you remain composed and you remain mentally alert, even for the next patient or the next client? So as I finish, I would like people to understand that grieving is not an easy process, neither for the professional and neither for the family. So we need to understand each other. Everyone is feeling the loss of the person who has just died. The people in the hospital setup are feeling with the patient when they lose their mental function, they lose their physical function, maybe loss like vision. When your patient loses vision, you are also feeling that, because it becomes even harder for you to manage this person after the loss of either the mental function or physical function. We need to do something about our loss. We need to process the loss. And this handling loss and grief for healthcare providers, for all professionals, needs to be taught at the basic training. So let us empathize with each other, because the person you are expecting to handle your grief could be grieving, could be dealing with a loss. And until the next talk show, I've been your host, Grace Wanjohi.